resilience is nothing but re-identification of who you are, in a much powerful way, in a much empowering way. This idea of normalcy, sometimes it becomes very disturbing, and I think somewhere reappraisal, re-understanding of what normalcy is and why it is not that important to always fit your child in a box. Often in this cycle, what goes unnoticed is the child's potential. So that connection, that emotionally connecting with your child and understanding who your child is.
Hello, everyone. Welcome back to India Autism Center podcast, your trusted space for meaningful conversations and powerful insights on neurodiversity, autism care, and empowerment of community. I'm your host for this session, Pooja Datta, and today we will be discussing a topic that is very close to my heart, that is very emotionally relevant. And yes, we will be talking about caregiver burnout. To discuss about this quite important topic, we have with us Ms. Alokananda Mukherjee. Ms. Mukherjee is a renowned clinical psychologist in Kolkata, and she has immense knowledge and experience in working with individuals in the spectrum. Hello, Ms. Mukherjee.
Hello.
It's a
Thank
privilege to have you here in this show.
Thank you for calling me over here. And I would also like to, add my best wishes to you and the center for creating such meaningful, impact in lives of children, their parents. And it's a beautiful work which the organization is doing. Thank you.
Thank you. So, Ms. Mukherjee, before going further into the podcast, I would like to understand briefly your professional journey and how did it infused interest in autism care.
So I have done my MPhil in clinical psychology, and recently I have submitted my thesis, PhD thesis, and my entire area of interest regarding autism through my work with my HOD, Dr. Jayaranjan Ram. And while working with him, I actually started developing a very niche interest and observation and clinical observation, especially towards the spectrum, understanding children in a very different way. I actually do not do a lot of work of intervention, but my main focus area and my interest area is assessment, and especially working with parents and helping them understand the spectrum, psychoeducating them. So these are the two main area which I focus. But my interest developed through my long years of clinical work.
Caregiving an individual or a child who is in the spectrum, it is quite emotionally and physically exhausting. In lines with this, can you please tell us, beyond the textbook knowledge, what is caregiving and how does it lead to burnout?
Caregiving is a very powerful and it's a very powerful and a kind of an emotional journey, because person needs a lot of capacity to offer care and help to another person, and for that the particular person needs to have that energy, the resilience, the capacity to offer help and support. If the person himself or herself do not have the capacity, he or she won't be able to offer that support. So for that, caregiver burnout is a very, very real condition. Often people who are in a position of caregiving, they often do not experience or do not acknowledge, I won't say experience, they do experience, but they do not acknowledge the impact of caregiver burnout. So caregiver burnout is a prolonged exhaustion, which can be physiological, which can be mental, which can be emotional, psychological, and which a person feels while offering care to the significant person, and it manifests through symptoms like fatigue, irritability, withdrawal symptoms, and it can also lead to, if it is unaddressed, then it can also lead to mental health disorders and psychiatric conditions. But in especially in field of autism and any terminal conditions, I've seen that caregiver often do not acknowledge the importance of the burnout, and they feel extremely guilty for even experiencing exhaustion. They feel as if that is not something which I'm supposed to feel. I'm always supposed to be very ready upfront to offer care and support, and I'm not supposed to feel any kind of exhaustion. So that actually increases the rate of caregiver burnouts. So there's been multiple researches also which indicates the severity of caregiver burnouts and how it can lead to severe mental health conditions like depression, anxiety, in such cases.
Before we move into the next question, please have a look at who we are.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
Coming back to the podcast, Ms. Mukherjee, let's talk about the broader impact. How do mental health challenges in parents affect not only just them, but also the child with autism?
Yes. See, this exhaustion comes in multiple ways and multidimensional ways. So, if we look at stress in a very larger perspective, see, stress always occurs when there is a stressor, a potential element or stimulus which causes stress. So, when it enters our environment, our situation, it causes an alarmed reaction, which is like our body enters into a fight or flight mode, which is like there is a constant alertness in our body. And how do we experience alertness in our body? There will be muscular tension, always tightness, rigidity in body. And if a person is in continuous state of tension, the person will develop a kind of a adaptation to that stress. So prolonged adaptation to a stress leads to exhaustion, where the person is like left with bare minimum. He can't do even bare minimum work, like taking care of himself, doing the day to day occupational functioning. So this is the impact of burnout or like on the caregiver. And as I mentioned, this might lead to very emotional troubles like mood fluctuations, mood swings, in certain cases not only sadness, but it can lead to clinical depression. There are caregivers who go through prolonged rates of and time like worry and apprehension, leading to clinical anxiety spectrum conditions and disorders. I've seen many mothers or parents who go through like bouts of guilt and grief process which prolongs to prolonged grief reactions. So these are the emotional impact. There are physical impacts where there are not only, I would say, physical exhaustion, but it also leads to GI issues, the multiple gastrointestinal issues that I've seen. And like while discussing with parents, I've seen they often report about sleeplessness, about having recurrent GI issues, including IBS. So that is also, these are all stress-induced conditions, autoimmune conditions. Mostly autoimmune conditions, in multiple researches, we have seen that autoimmune conditions are stress-induced, and it is often occurs when those are repressed for a very long period of time. So there are multiple aspects, and other than that, mental and psychological symptoms may be that the patients like the caregivers have difficulty in attention, concentration. So suppose you see that if the caregiver is going through so many difficulties on a multiple levels, may not simultaneously it may differ, that different person may experience different things. Now you see, with such health conditions or such mental health condition, when he or she is offering support to a child with neurodevelopmental difficulties, so the child also will feel very lost, helpless, disturbed. And if the caregiver cannot offer patience to such a child, so the child will also become equally irritable. And that's how the vicious cycle is. It just not only impact the mother, but it also impacts the child, because the child also feels very lost. Often the child feels that I'm not being heard, listened, and the symptoms or the behavior, the problem behaviors, are not often dealt with a lot of patience, tolerance, and understanding. And that increases the disturbances or the family conflicts. The home environment becomes very disturbing, where overall the like what we call as frustration tolerance, the level of frustration tolerance reduces. No one can tolerate minor difficulties in the environment or in the home. So that how interdependent uh, the difficulties become, that it not only affects the mother or the parents, but also the child in a larger frame or cycle.
So it comes in my mind that at times autism individuals in the spectrum, we say they have invisible disability. At times it is not visible, so we
Yes.
cannot understand.
Yes. Yes.
And so is the caregiver burden, the caregiver stress, I feel.
Absolutely.
That they are not showing it, but society expects them to be perfect mothers,
Absolutely.
like super mothers of superheroes, right?
Absolutely.
So
in some cases, it can be mothers, it can be anyone who is providing caregiver in that case. So it's very important to acknowledge that yes, it is present. I'm a human, I can feel it. And as what you said is exactly that, I'm not any super human or godlike person who have extreme qualities and who cannot have exhaustion and burnouts. True.
so you rightly mentioned mothers or fathers, right?
Mm.
But especially in countries like India, where males, they are always supposed to be, quite right, strong, they cannot show their expressions, emotions. Mothers can have a breakdown, but fathers cannot. Thus is the role of the society. So can you please, share your experiences where fathers, they are coming out with these caregiver stress, and what kind of reactions do they have?
See, with fathers, it becomes very difficult to acknowledge, as what you rightly mentioned, to acknowledge their emotional, uh, problems and difficulties. Primary being they are not even in sync, or often not in connection with their emotions. With women, they are more in connection and sync with their emotions. They know that okay, I'm feeling sad, I'm feeling angry. But with fathers and males in general, they often try to overlook their emotions and doesn't put a lot of significance and emphasis on that. They put a lot of significance on activities, actions, or what I'm supposed to do. But how am I supposed to feel? How am I feeling? They rarely acknowledge it. And the family members also do not expect them to feel so much about it. So they actually struggle a lot. But I've also seen many single fathers who are working beautifully with their children, and taking them like to various interventions, bringing them they themselves seek professional help. I work with one such father who has a child with autism, and he seeks professional help individually to uh, cope up and accept the fact that his child has autism and he can have a life of his own, which may not be the one he has set for him or imagined for him. It may be a different life. So he wants to work on that. So there are also parents with such level of psychological mindedness.
Now we move into some hope, some positive aspect of this discussion. We'll be talking about resilience. What do you feel how important resilience is? And rather than being idealistic, if we can get some practical guidance on how to develop resilience and how this development it leads to gradual reduction and effective coping with caregiver burnout.
True. Resilience is basically, it is the ability to cope up from adversity. So there's a very beautiful thing in resilience, which is, in order to be a resilient, you need to have certain level of adversities in life. It may not be a very like unnerving amount of adversity, then you will succumb. But if there is no adversity in life, you won't be able to develop coping strategies, mechanisms, to even to understand that yes, I have capacities to deal with difficulties and problems in life. So in case of caregiver burnout also, what is very important, how actually resilience helps in this, is resilience helps parents and caregivers to develop problem solving abilities, and those problem solving abilities help them to cope with the stress of caregiver burnouts and gradually help in increasing their resilience. So once their resilience increases, they can prevent mental health conditions. There is an enormous amount of studies which suggest that resilience is actually a preventive mechanism to prevent mental health disorders and psychiatric conditions. So if the parents are, or if the caregivers, they can prevent themselves from developing further mental health conditions, they can offer a lot more support and care to their children in a much more structured and organized way. So that is the beauty and power of resilience. And as you mentioned, that what are the steps or techniques of how we can develop it, so I would say in that case, the very first thing is acceptance. In my clinical work, what I have seen is most of the parents, they suffer a lot, or they face a lot of difficulties in accepting and understanding what is autism, especially that it works on a spectrum. Like someone's child has certain symptoms or certain strengths or abilities, doesn't mean that my child will also have similar traits or similar strengths or similar difficulties. So understanding this spectrum, and it comes with variety of possibilities and variety of opportunities and variety of difficulties. This is the very important aspect of resilience building, that is the acceptance of the condition and what I can expect and what I cannot, which means setting very realistic goals from your children, understanding that like suppose like for example, I was working with a family, and the mother very beautifully, she herself came up with this idea, like the child had a very repetitive behavior of tapping. So what the mother, after a lot of intervention, the mother realized that this repetitive behavior can be turned into helping the child learn piano. So once the child started learning piano, the same thing, the child also in like the child was also involving in the repetitive behavior, but in a much structured way, in a much better or a beautiful way. So another thing which I was also while I was coming to the center, I was remembering that there was another child who had some obsessive symptoms of hair cutting. So initially, so he would go to a barber every week to top of his hair. So initially the parents were very uh, annoyed, and they were having a lot of difficulty to adjust with this, that how to stop him. But with gradual intervention, the parents understood that our perspective was just focused on changing this behavior in a way to stop this behavior. But there can also be alternative perspectives to it. So gradually, the parents also looked at a brighter perspective, that by doing this, the child is also increasing his social skills. He is going to different barber each time, interacting with them and finding out which haircut is the best one. And then he's settling for that because he has obsessive tendencies of going for a perfect haircut. So, and then they started appreciating the child's social skills, analytical skills, of how each barber is different from the another and how he could select the best one. So this conversation again led to a multiple other opportunities and possibilities, and the dynamics between the child and parents also in like differed or improved in this context, in this topic. So So these are also different ways of how not looking one thing from one perspective and just focusing on stopping problem behaviors, but it's more like, in a very simple language, if I say, bringing about some alternative perspectives to it. Another thing in acceptance is very important is the progress. Often working with children in autism, especially in professional intervention settings, progress are not always in a very rapid structure, or not always very, as you said, about invisible. Often there are improvements, and but it is not always visible immediately. So having this tolerance and patience and understanding how intervention works is also another aspect of developing resilience. So this, I would say, is one part of resilience development, which is overall ideation, understanding of the condition. Second, I would say, which impacts many, especially women, uh, they discuss a lot, is about the home conditions, conflicts between parents, and they are not on the same page when they talk about the child's treatment outcome, facilities, and what are they expecting together, and there are frequent conflicts at home. So for especially whoever the caregiver is, he or she has to have develop this ability to ask for help, to distribute responsibility, and to focus on working on developing kind of a healthy home environment where there is lack of conflicts, lack of chaos and difficulties. So asking for help seeking, is also a very, very powerful coping skill. We often feel, that especially in very dire and difficult situation, we feel that as if help is not available and help is not possible. Whatever I have to do is I have to do. Most of the mothers I have seen, they have this idea that help is not available. So, but that may not be always the reality. It is their perception, and how long term stress and often difficult experiences makes them feel as if help is not available. No, research suggests that help, social support, and help seeking are very powerful tools for resilience and coping skills for resilience. So that is working on family dynamics. Family is a very, very powerful mechanism, and especially children with autism. And if the child, any, not only, I guess, not only it's the child having autism, but any child, if there is frequent conflicts in the home and there is no consistency in the home environment, child will be affected. It will affect the child's emotional health. So that is somewhere that is very, very important to take care of. The third aspect I would focus on is the very basic skills, which are, one is taking the caregiver who are offering care. They need to take care of their sleep, their appetite, and breaks. Taking breaks is very, very important in their schedule. Continuously working without any break, which I've often seen, they have been reporting that now I've brought the child and after that I have such and such. And especially parents who are working, or caregivers who are working and managing uh, children care according simultaneously, it becomes even more difficult. And sleep is very, very important. If there are sleep disturbances, insomnia, it leads to multiple mental health conditions, and mood fluctuations, mood disorders are one of the primary indicators that there is sleep disturbances in the person. So these are very important. Setting very firm boundaries, do not to have very permeable boundaries, like to know that this is what I can offer or do, and this is something which I cannot do. So saying no, limit setting, these are very difficult, very, very difficult, and it often induces a lot of guilt in parents and caregivers that I'm not being able to do what I'm supposed to do. But again, if we go back to from where I started, that we are not superhumans or gods and who have infinite capacities. And if you push yourself to the amount of exhaustion, your body will take a very long time to recover from exhaustion. so which will not only affect you but also the caregiving of the child. So taking care of guilt, having setting very realistic expectations of self and also about the child in such cases is very, very important. Other thing is engaging yourself, in having a support group. It can be a parent support group, where parent support group helps a lot, because their parents also feel a lot of hand holding, that I'm not alone in this journey. There are also other parents and caregivers who are going through similar difficulties, and often I have seen that parents also pick up on multiple coping skills and intervention skills in such parents group. Maybe from the professionals, because the professional time or the therapy time may be 1 hour, but with the parent support group, they can befriend someone, and through them they also learn a lot of things. They go on like dates, or like outings, and so that also releases a lot of pressure. So social support, accessing social support, community support is very, very important and gives a lot of release in that aspect. I think your organization is doing a wonderful job in by creating residency. So that is also something which comes under community and social support groups, and how they can offer help. One of a very powerful coping skill is what we called in our clinical work. It's called as reappraisal. Reappraisal means how to perceive a situation in different ways, in alternative ways, like the understanding that there are alternatives to it, and not just one perspective or one outcome to this. So if it is not occurring in one way, there can be alternatives, like the two examples of a child which I gave. So cognitive reappraisal is also something which people can practice. It's not something which will develop, but there are multiple informations on cognitive appraisals. Then journaling is also very, very powerful. How journaling helps us to be in connection with our thoughts and emotion, and it prevents suppression of emotion. We do not repress or suppress emotions. So that again helps caregivers to have outlets of their emotions and prevent suppression, which again might lead to multiple psychosomatic conditions. So in such ways, such small ways, then there are relaxation, mindfulness, breathing exercises, which helps the body to relax and release the tension and stress. So there are these multiple ways of how such coping skills can help the person to develop resilience and prevent mental health conditions in caregivers, which in turn will help the child to be in a very especially children with autism who have sensory symptoms, they need a very calm environment. So this calmness, if it's not there inside me, I won't be able to offer the child the calmness outside. So the calmness has to be first inside, practice that well, and then offered it to the child's environment and to the child. So that's how, to an extent, we can bring about this.
The techniques, ma'am, it was so technically said with so much empathy and compassion. Thank you for that. I'm
Thank
very
you.
sure the parents, the caregivers who are watching this, they will be quite benefited and they can resonate with what you said. To our
Thank
viewers watching there, if you feel that this podcast, it matters, it is insightful, then do not forget to like the podcast and also please subscribe to our video channel. In alignment with the previous discussion, there are some parents who are still struggling with acceptance.
you.
Resilience is quite way ahead in the
True.
journey. So, ma'am, your practical tips for those parents who are really suffering.
See, I guess with acceptance, the very pivotal challenge I've seen in parents is um, expectation of normalcy, like this idea of normalcy, and my child will be like other children. Like whenever children, like parents come for assessment, post assessment, they ask me one thing. Mostly I see patients like from various regional languages, but when it really strikes me, je madam, theek hoye jabe to, উন্নত মানে এই যে একদম ঠিক হয়ে যাবে তো? বাকি বাচ্চাদের মতন হয়ে যাবে তো? এই যে বাকি বাচ্চাদের মতন হয়ে যাবে তো, this is what, like, they will be like other children post intervention. That is what they expect. And so when I tell them that there will be a lot of, you know, improvement in problem behaviors, but I don't know what you mean by baki rest of the children, because your child has some assets and some difficulties or problem behaviors, and that may not be like someone else who has a different set of assets and strengths. So working on understanding your child, observing your child, and finding out your child's strengths, assets, and problem behaviors, and then to start working on it is so very important, rather than entering into a comparison that such and such child has such and such strengths and deficits and my child has such and such. So this idea of normalcy is something which is very, very, sometimes it becomes very disturbing. And I think somewhere reappraisal, re-understanding of what normalcy is and why it is not that important to always fit your child in a box is primarily very, very important aspect of this condition. When you remove this idea of putting your child in a box, you will actually be able to connect with your child. So that connection, that emotionally connecting with your child and understanding who your child is, rather than that he whether he's fit to be in a school, do normal education, school education, or then get a job or such and such things. So this actually takes the parents away from understanding the child and seeing the child's potential. And often in this, cycle, what goes unnoticed is the child's potential, the child's emotion. So that's why this is one very important aspect. Another is addressing the stigma. There is a lot of stigma not only associated with autism but at a very larger scale towards mental health conditions. And that also prevents parents from acceptance and from reaching out for asking professional help. So addressing this stigma not only at family level but also from community, it's also our job, our as professionals, community's responsibility to work on this stigma and break this stigma so that parents feel more comfortable in talking about this.
So resilience, this is rather a skill that has to be nurtured.
Yes.
Can resilience be built up at a family level, especially with individuals who are in the spectrum?
Yes, absolutely. So, like suppose this about frustration tolerance. So, how, like, addressing demandingness, or these are also something that allowing the child to be frustrated and not reaching out for not allowing the child to immediately come out of that frustration by fulfilling this demand. This is a very small example of frustration tolerance and also of resilience. As parents, we often feel that, if the child is crying or throwing tantrums, we need to offer immediate relief to the child. So allowing the child to be in that state of frustration and understanding that what can I do, especially this can work with children having high functioning autism, that to so that they can apply their cognitive abilities to understand what can I do in this situation, what are the other alternatives in this situation. And for exercising that in the family, the parents also need to have very well balanced frustration tolerance. So if the parents cannot tolerate their frustration or there are frequent outbursts, so then obviously they won't be able to do the same exercise with the child. So in this way, like suppose with this example, so this can bind the family together and help each other in developing skills. So resilience can also come in multiple ways, like suppose helping a child with autism to understand death, loss, what loss is, and how it is it's a fact of life. So social stories helps, very very important, like it's a very important tool of helping children with autism to understand absence, loss, like because they have to be, especially children with high functioning autism, like they have to be uh, explain that in a very concrete way, so that loss and absence means very tangible understanding, because loss is a very abstract thing. What does absence means? It is, this book is there in front of me and now it is not there, and not there means permanently it is not there. So these minute understanding can only, parents can only help their children when they have well balanced emotions and they have regulated their emotions well, to discuss these minute aspects of grief, loss, sexuality. I can also share this situation, I which adolescent child um, who has, who is a high functioning, who has like the parents have reported symptoms of obsession, like repetitive hand washing, cleaning behavior. But gradually, while interacting with the child, she started asking me about that. Why do I feel certain very strange feelings in my body, and in a certain in my certain body part, while I see someone in my school, and I don't know what is this feeling about and what to do with this. I want to go to that person, I want to hug that person, but what is it? I don't know. So gradually, while interacting and using, so the child was very good in painting. So I asked the child to pinpoint the body sensations and where actually it is occurring. So she pointed out, and we gradually understood that it is her. So she was actually having sexual feelings and a lot of curiosity about her body, about that person. She was also feeling attracted to that person, and she didn't know how to name that. What name can she provide to it? So these are also the aspects of how where encouraging the child to talk about it, normalizing it. We then introduce the child with some social stories, very age appropriate sex education videos, and helping the child to understand it's very very normal, and what she can do, and the kind of conversation through role play that she can do with that person. So these can only occur when, and these also definitely these develop resilience, because I am able to express, voice out my feelings. I know what I am feeling. I am in charge of my feelings. So that is a very empowering feeling for children. So these are also ways of how, at a family level, with adequate families education, with family, like where the parents also know how to deal with these conditions and they normalize these conditions, so they can develop resilience at a family level. I'm not sure if I've given some light to the question
You are
that.
absolutely on the right track, ma'am, giving so much of insights, like step by step. It is really meaningful. We can relate to it. Moving to the next topic that is aligned with the previous one again. There are many adults with high functioning autism. I'm talking about high functioning autism because to an extent they can verbalize. Even the same applies for all individuals who are in the spectrum. When they are into their adulthood, the journey, there are different obstacles, there are different realities that they are not able to accept. So, with these individuals, ma'am, can resilience be built even when they reach adulthood?
Absolutely. Resilience is a lifelong process. There is initial researchers suggest that resilience is only for children, but now recent modern researchers suggest that resilience can be built. It's a continuous process. It's a journey, I would say. So there is no fixed goal of it. Just like spirituality, like there's no fixed goal to it. So similarly of resilience, like gradually, even in adulthood, people do realize a lot of aspects about themselves. So especially adults with autism, they, and especially if they are high functioning, they, I have seen they gain a lot of impetus and knowledge or understanding about their self once they entered into adulthood. So understanding, awareness, introspection, this actually increases the scope of resilience in a much better way than in adolescence or in childhood, I would say, especially with children, when adults with high functioning autism. So the scope becomes much more wider, where they start exploring themselves. One such aspect, I think, I'm not I professionally do not practice it, but I've done one or two workshops on this, and I have also seen my colleagues and seniors talking a lot about it, is social role valorization. So social role valorization, the core concept of it is resilience building, like helping them to identifying their potentials and channelizing them in the community level, so that they have alternative identity, not the identity of only that adult with autism, but they are, like suppose a citizen of India, they are a worker, or they are a teacher or a painter, or someone who works at a cafe. So developing alternative and more profound and meaningful identities is also a journey of resilience, where initially the transition from that I am just an adult with high functioning autism to I am a painter, I am a gardener, I am a teacher, I work at a cafe, or I do artwork. So, and it's something which your organization also does. So, there are multiple possibilities that. So, resilience is nothing but re-identification of who you are, in a much powerful way, in a much empowering way, that I'm just not this, but I'm so many others thing, and there are so much other possibilities that I can become. So there are multiple possibilities, but it's just like, you know I would just like to state a very basic aspect of spirituality, over which is so linked with resilience, that spirituality says that, we all have enormous potentials within us, but we are not aware of it. So that same goes for resilience, that we have a lot of potential, but adversities, like a larger amount of adversities, just suppresses those potentials. So with resilience building, we actually again uncover those masked up or suppressed potentials, and we understand that, oh, this is also who am I, oh, I didn't know this is something which is possible for me to do. So that helps us to see ourselves in a much better and empowered way.
So many different facets of resilience,
Yes,
dynamics.
absolutely.
Another relevant dynamics, ma'am, I would like to shed your experience on resilient parents for individuals who are in the spectrum. Their unity, how does it matter?
By parents, you mean couples?
Yes.
Yeah, so very, very important, very, very important. So I think in family dynamics, I was mentioning it. One of the key role of family dynamics, one of the important pointers of family dynamics is to have a healthy relationship between parents. If they are not consistent, if couples are not consistent among themselves, it is going to be very difficult to manage household, manage child, manage work, and it is going to lead to be to a very negative expressed emotion. By expressed emotion, I mean the dominant emotion in the home environment. So if there is constant critical comments, like hostility, or if there are constant outbursts in the home, and if there is if the same relationship are between parents, they won't be able to work together hand holding in a very hand holding manner, and they won't be able to take care of themselves nor the child. So as couples, there need to be a lot of consistency among parents, and if there are inconsistencies that need to be discussed, they need to have very open communication and need to be discussed that where they are not being able to be aligned. And in such cases, I often send couple for couples therapy, because so this terminology is also very important, parents and couple. So it's not very, so you do not have to be parents all the time, you also need to be couple and look at
True.
your individual dynamics. You can't just give away all the other aspects of your life, and that is also a very very important aspect of caregiver burnout. Like my happiness, my pleasures, or pleasures as a couple, like going out on a date or going somewhere together, having a time of their own without the child also, is very, very important to again bring back the relationship between them. Because so the primary tag is not we are just parents. We are parents, but there are also alternative and other identities that we have. So parent relationship, very very important, and in that, another thing is very important is accessing support from family members. I've like not only I, but research also suggests that children who have and parents who have very good social support, they work beautifully with children. The children also grow a lot, they are very happy children. And this, I'm not talking only children with autism, in general every children, if there are adequate social support, if there are supportive family members, supportive people around you, you always nurture, grow, you can take care of everything, you're a happy mind then, and you can do everything happily. So social support, accessing family members support, and having very good relationship among spouses is a very important indicator, as indicator of resilience and caregiving.
And ma'am, before leaving you, some practical guidelines or tips or strategies that you can quickly give to the parents who are watching there.
Primary thing, I would again say, it's a very basic thing, but please take care of yourself. I say this to each and every parent whom I see who are very flexed and very stressed out, that they don't look at themselves. So looking at yourself, that, and observing yourself, looking at your thoughts, looking at your emotion, looking at your body, again I would say that body is very 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 important. So looking what your body signals are, body signals you each and every time whenever there are difficulties. So this, if there are tensions in your body, alertness, your body is exhausted, please do listen to your body, do not overlook it. Take enormous amount of sleep, good amount of sleep, have good food, take breaks, and uh, do not, I would just say that it's very important to respect yourself and take care of yourself, do not neglect yourself. This is a very very powerful, because if you are half full, you won't be able to offer support to anyone else, right? So there is a theory in our this is a container contained theory. So the container need to be full enough to contain things, because as parents you are containing a lot. You're containing not only your children's difficulties and children's the outcomes and their goals and their future, their, but also multiple other things you're containing within you. So if you are full, you won't be, if you're full with all the negativities, you won't be able to offer any support. So you need to be full in a positive way, in a healthy way, so as to contain things that is coming to you.
Thank you, Ms. Mukherjee. You really not only explain resilience, how important is, and the different facets of resilience with so much technique, at the same time with so much nurturance, empathy, and compassion. Thank you so much.
Thank you so much for having me here. Thank you.
To the viewers, I know mostly parents, your mental health matters. You matter to us. So please take care of your mental and your physical health. Only then can you nurture your child. If you feel that you have learned something new from this video, please do not forget to hit the like button, subscribe to our video channel. Till next such interactive video comes with another expert, please do watch the videos that are displayed and also the video that is popping up in the screen. Thank you so much.